Welcome back to my channel everyone. Today I'm going to be thinking about how I had done my eye surgery. You guys can see me that I was wearing a thick glass before this, and recently I have done my eye surgery. I will tell you who is suitable for eye surgery, specs removal surgery I would say, and what are the options that is needed for this surgery. First of all, there are two types of surgery. Number one is laser surgery, and in that laser surgery so many different kinds are there. For example, LASIK, SMILE, and the latest one is called the contour vision, and the second option is putting a permanent lens inside our eyes, that is called ICL. For me, I have done the second option. I will tell you the reason why I have chosen that. First, let me explain about the LASIK surgery. In the LASIK surgery, what doctor used to do is they used to cut a little bit portion of the cornea. They used to flip that up, and they with the help of the laser, they used to cut the tissue of our eye in order to adjust the power of our eye to zero. That is the first option you can do. And in the contour vision, they have improved that methodology by using only the machines. In the laser, they used to cut manually by slicing, just I don't know what they called it. But in the contour vision, they used to do with the help of a sophisticated machine. And after that, the procedure is same. Who are suitable for that kind of LASIK surgery or contour vision? So the first and foremost condition for that is you must have an stable eye power, and your eye power must be between minus 1 to minus 8. Beyond minus 8, some complications is there. The one who have the dry eye cannot do that, and the cornea should have proper thickness, and above all, they will do so many tests before you have done the surgery. And what are the risks for that LASIK surgery? And the risks for the LASIK surgery is that you might have halos in the nighttime. Halos is what you call halos is like if you look at a bright light, suppose a bulb is there. If you look at the bulb, then a round circular marks you'll see a round circular things like that with a bright like that. That is called a halos. Sometimes night blindness or somebody had happen. The main problem is the dryness of eye. In most of the cases who have done the LASIK surgery, there is a cases of dryness in the eye, and the recovery time, it would take around 1 month for the recovery time. You have to wear this kind of glasses after the surgery. You cannot wash your face. You have to use the tissues, and you have to use the eye drop, lubricating eye drops and all. That's all for it. Let me explain about the surgery what I have done. That is called ICL surgery. And in this ICL surgery, they have done the pre-surgery test for around 20 days. Actual surgery happened, and my eye powers was above minus 8. So I was not fit for the LASIK surgery or for the contour vision. But my dryness and all above criteria, it was fit. I was fit for the other criteria, but my minus power was too high, so I cannot go for LASIK surgery. I might have gone for that, but some complication might have been there. So I just left it, and I just choose for the ICL surgery. Oh, let me tell you about the cost of these things first. For the LASIK surgery, it would cost from around 30,000 to 50-60,000, and in the contour vision, it would cost around 90,000. And in the ICL surgery, it would cost around 1.5 lakhs. And after I have done the pre-surgery test, I have to wait for the lens. The lens which is to be implanted in my eyes, this to be imported from Switzerland. India has not made it till now. ICL means implantable collamer lens. This is something similar like the one that surgery which is done in the cataract surgery. You might have seen cataracts, those who have seen the cataract surgery, you might have been familiar with that. The procedure is a simple procedure. Before the surgery, they will put some drops in your eyes, anesthesia drops, and they will in your hand they will inject some injections so that you might not feel vomiting or headache or something like that after the surgery. That is not related to the eye. And just after putting the anesthesia, they will just mark and reference point in your eye. You'll not feel anything. That is like your eyes will be totally numb at that time. During the surgery, the surgery takes around only 5 to 10 minutes. They will cut 3 holes. 2 are the small holes, something around less than 1 millimeter, and the main incision would be around 3 mm. And they will put the ICL through injector, and just after that they will tuck in the ICL, and that's it. And I don't feel any uncomfortable or any pain or pressure during that surgery. It was just fine. I have to just look at the bright light just for 5 to 10 minutes, something like that, and doctor will do automatically just one by one after another, and you'll not feel anything. You won't feel that you are doing an operation there. And just after that, they will close your eyes with some bandage, and your eyes will instantly see after removing that bandage. They removed my bandage just after 2 hours, and I can clearly see after that. Yeah, it was little bit blurry, but they said in the next morning you'll see finally. And then when I wake up at the next morning, wow, it was so clear that I would say it was the eye. It was just like the eye I have got from my mom when I was born. So it happened like that. And the ICL surgery took place in 2 days. First, for me, my right eye operation was done on 26th of April, and on 27 I have done my left eye, and I'm totally fine now. No problem is happened so far, so I can clearly see, read anything far off. My power has come down to 0. So if anybody of you wants to do this ICL surgery, then you must have gone through the net. ICL is the best option for everyone. For those who are unfit for LASIK, why everybody is not opting the ICL surgery? It is because the main problem is the price. It is 2 times higher than the normal LASIK surgery. And the second is that in India, in most of the hospitals, this option is not available till now. Only a few hospitals this option is available. In my case, I have done my eye surgery in I7 Hospital, Delhi. I7 Hospital, Delhi. It is located. It was in the Dairaganj branch under the supervision of that Dr. Sanjay Chaudhary. He is a very nice doctor. He has a 30-year experience in this eye surgery and 12 years experience in this ICL surgery. So thank you so much, Dr. Sanjay Chaudhary, for giving me my eyes back. That's it, guys. Oh yeah, I have forgot to tell you the drawbacks of ICL surgery. Yeah, what are the drawbacks? So the only drawbacks or risks I would say about this is that I might have get cataract in an earlier stages of my life. That is only the risks. Or other than that, the night vision is so clear, and halos are also less in this case. So that's it, guys. So anybody of you, if you want to go through this ICL surgery, so you can contact me. I will give my email account in the description box below, so you can contact me there, and you can contact me on my Instagram account. My Instagram account is aarbindro, aarbindro, so you can contact me there. Bye bye, guys, for today. Thank you so much.